Hello, Mr. Perez. I am Dr. Duazon, and I will be doing a physical examination of your neck today. And before we begin the exam, I would like you to relax and loosen up your shoulders. And if in any part of the exam you will feel pain and discomfort, just tell me.
There are no special equipment needed in doing the neck examination. Proper lighting in the room should be ensured, and gloves may be worn during the examination. In special cases like the presence of pulsating masses in the neck, stethoscope may also be used to auscultate for thrill or bruit. To start with the neck exam, you may position yourself in front or behind the patient. The latter is preferable to feel the thyroid in patients with a larger neck. The exam may be completed in any sequence, but you should develop your own routine. First, inspect for symmetry, size, how the patient carries his head, and note the tone of the neck muscles. Inspect for different contours and surface landmarks, as well as the overlying skin changes, and the presence of any fistula or tract. Examination of the cervical spine mobility in all planes should also be tested, such as flexion, extension, lateral rotation, and lateral flexion or bending.
The next part of the examination is checking the major triangles of the neck. The neck has two major triangles, the anterior and posterior.
Now, I'll be checking the anterior triangle of your neck.
The anterior triangle of the neck is bordered by the lower edge of the mandible, the sternocleidomastoid muscle or the SCM, and the midline. It is divided into two, separated in the midline by the central components of the neck and defined posteriorly by the SCM. There are two subtriangles in the anterior neck, the submandibular and the submental. The submental is midline and the submandibular are lateral. The posterior triangle is bordered posteriorly by the trapezius muscle, inferiorly by the clavicle, and anteriorly by the posterior border of the SCM. Bimanual palpation is done posterior to the seated patient while comparing each side. Flexing the neck slightly will relax the soft tissue, permitting easier palpation. In palpating the neck, feel under the trapezius. Feel the floor of the posterior triangle. Specifically, paying attention to the space underneath the clavicle. Gently place the SCM between your thumb and index finger to palpate the muscle, and then palpate the soft tissues of the neck. In addition, palpate the area behind the angle of the jaw. This is the area of the tail of the parotid, which is a common site for parotid tumors, and then palpate the remainder of the parotid gland. In the midline of the neck, you may palpate the following structures. First, the hyoid bone. It is the most superior and extends laterally to its greater cornea. Below this is the thyroid cartilage. In the midline, at the top aspect, is the thyroid notch. The thyroid cartilage tends to be larger in men than in women. Inferior to this is the cricoid cartilage, and the tracheal rings may be palpated inferior to this. The thyrohyoid and cricothyroid membranes sits between these structures respectively. The thyroid gland sits on the side of the trachea. The isthmus of the thyroid sits just inferior to the cricoid cartilage. If the patient extends his neck, the thyroid outline may be seen under the skin. You may palpate the thyroid gland from in front or behind the patient. When you have the patient swallow while palpating the gland, you may feel its edges on your fingers. Nodules of the thyroid gland may be palpated as well. A thyroid nodule that is palpated is usually at least 1.5 centimeters. Any new nodule should have an ultrasound-guided fine needle aspiration to determine if it only needs observation or should be removed. At times, the gland may be firm, suggesting Hashimoto's thyroiditis. In children, it is not uncommon to find lymph nodes in the neck, which usually disappear by the age of 12 or 13. Lymph node groups of the neck should also be assessed systematically. Use your finger pads to assess the lymph nodes on the following areas: submental and submandibular triangle, along the sternocleidomastoid muscle and neurovascular sheath, down to the supraclavicular lymph nodes. Back up posterior to the SCM, going to the occipital region.
I am now done with the physical examination of your neck, and I will be recording the findings. Thank you for your cooperation, sir.